What are the risks of rhinoplasty? With any surgical procedure, there's always infection, bleeding, scarring. Bleeding, most patients tend to experience a little bit of bloodstained discharge in the post-operative period, most commonly in the first 3 days. Internal and external scarring, there's a small scar at the base of the nose with rhinoplasty through an open approach. You can get some internal scarring which takes around a year to settle. Swelling, I use piezo, which is an ultrasonic vibrating tool, so swelling is significantly reduced with the technique that I tend to use. You will get a little bit of swelling under the eyes, a bit of swelling over the bridge, and there's some tip swelling, but that tends to settle really quickly. With any septal procedure, there's always a risk of making a little hole between the partitions of the nostril on the inside of the nose, not visible from the outside of the nose. There's always a small chance that you're not happy with the cosmetic outcome of an operation. In my practice, I end up having to do a revision procedure in around 2% of patients. So over the last 2 years, looking at the last 200 procedures that I've done, around 4 patients needed a small general anaesthetic revision in order to tweak a small element that hadn't healed or settled correctly. Tip numbness, you do get some swelling and some numbness of your nasal tip for around a year after the surgery. Firmness, most patients want a slight lift of their nasal tip, and when I put a small graft in there in order to undertake that procedure, you do get some firmness of the nasal tip as a result of that. If you've got any questions or queries about rhinoplasty, I'll answer the majority of them in the consultation. My website has loads of details about the risks and benefits and also the post-operative recovery. Please contact my secretary if you need to schedule a consultation or if you need any further details.